First of all, I'd like to thank all the families who've been in touch, saying such nice things. Also, we've been up for some criticism as well, which we've appreciated because it's allowed us to relook at different situations. So we're open. It doesn't all have to be good. We want anything that's creative. I do really want to thank our phenomenal staff. The guys in the homes, just everybody, the management team, everybody, because I know how hard they're all working. I know that out of hours, data's being processed, things are happening, and so on. So I just really want to make that statement. They're absolute heroes. All of you guys are heroes. Okay, on to the mundane stuff. Food, yeah, that's under control. I think we're looking at creating or taking the opportunity to slightly change the way that we will be working with food. We're going to look at the guys who supply us these meals, perhaps to supply us sources as opposed to meals in the future, and then to break down the menu cards and so on, so we can sort of produce more actually within the homes and make the activities better and use it as an opportunity to upgrade, hopefully, staff skills in producing food by having a more sort of nuanced approach to the way we do it all. Okay, staffing levels. Staffing levels are great. We've got no problems there. We've had good uptakes from our recruitment. We're going to start to slow things up a little bit because we're reaching high numbers. So that's all been very good. Okay, PPE, very unsatisfactory, our discussion with Public Health England. This has not moved on at all. They're saying that they'll talk to us. But then meetings haven't happened, and then they're saying that the meeting that they will have with us will include loads of other people as well. Well, then what's the point of that? This is just, it's just box ticking, frankly, because what they need to do is to change and adopt a different view. I'll come on to that. Testing is a disaster. Okay, Matt Hancock, all these numbers, it's a joke because they might be putting out these numbers. I think today 120 odd thousand. Let me tell you, the results coming back are taking 7 to 10 days. Well, that was never the case before. Not only that, whereas they were putting nurses into our homes in order to be able to carry out the swabs, etc., they're not doing that anymore. So now we're having to take individuals to the showground where the testing is failing because they don't have the competency to be able to take throat swabs or nose swabs or whatever from guys who are really complex. What are these poor people doing their best taking these tests? What do they know about the complexity of this? So joke, absolute joke. Activities. Yeah, we're relooking at the activities all of the time in the homes, and we're rolling out lots of new things and so on. And the idea is to make time as meaningful as we can. But at the end of the day, there are limits to what we can do. And what's important is that the individuals are happy. And I certainly know from my daughter's point of view that she's very happy from what I can see from films and so on. And I have no greater information than that. But I also know that she's not doing her horse riding and she's not doing her swimming and all of those great things. So everything it is what it is, I'm afraid. But it's, we're really, really on top of making sure that people are happy and content. And we're doing the best job, and the staff are in the most creative ways possible. And that's the other thing, we are really trying to unlock everybody's creativity. Okay, going back to sort of the new norm, the way we analyze this is that, it's almost like we had this, if you take the war analogy, it's like we were almost overwhelmed by this horrible virus that came out of nowhere. And I think everybody reacted, the government reacted actually really well because, you can always say they should have done this, should have done that, etc. I think they've been very let down by the organs of the government, which is the bureaucracies. And actually, to be fair to the bureaucracies, they can only act in the way in which they were acting in peacetime, if you like, because there is a style of action which bureaucrats follow and so on. Okay, that stops now because we're in the new norm. And what the new norm means basically is that we're now in what we're calling the COVID-19 insurgency. This is where it's going to keep popping up and so on, and it's going to be for different local reasons, etc. Okay, to fight that, you have to have data, you have to engage with local providers, with the local communities and so on. And this is where we're now really hypercritical of Public Health England, NHS Digital or data, whatever bit it is that has all the data. Boy, if they've got the data. CQC, we don't know what CQC are doing. I mean, other than reporting on dead bodies, which is terrible, terrible thing to be doing. There is no creativity coming out of them whatsoever. And we're saying, you've got to engage with us. You need to engage, because that's how you solve problems, is by engaging, which requires transparency. And that is the shocking thing that's coming out of all of this, is there is no transparency. It's almost like, well, we're not going to tell you this stuff, we're holding it all to our chest. Well, just trade your transparency and you'll get solutions. So we have actually cut another video around this, which is going out shortly. And we're just really trying to say, we can solve this, but we can solve it together. And the ministers, they need to start to understand there is no big silver bullet going forward, other than a change in policy, which is engagement. Engage with individual providers, throw us the problem, let us come back, let us be the Bletchley Parks of this environment. We've got unbelievably skilled people who are on the front line, who understand all of this. We can make a difference. Share the problem with us. Now, anything that you as pet families can sort of do to help us in whatever way, please do push it, because that's the only way we're going to get out of this horrible sort of insurgency type situation where it'll flare up, it'll go down, then it'll come back again and so on. It's by engaging. Transparency. Thank you all very much. I'd like to wish you all a great weekend and speak to you next week. All the very best.